Don't worry. Chalo, Devesh, start karo. Great. Good evening, everyone. Thank you again for joining on this lovely Sunday evening. And we are back with another doctor. We will be launching today Dr. Rashmi Doifode from Thane, Maharashtra. In fact, when I first met her, I remember there are very few doctors who are very good in knowledge as well as the communication and the confidence. So she is having the blend of all three: excellent knowledge, uh, great communication, and the confidence in her statements, the communication, the way she is presenting about herself. And she's an expert in specifically the gynecological disorders. uh, Garv sanskar, I think, a very important aspect which all the pregnant ladies should understand. आपकी फैमिली में कोई भी प्रेग्नेंट लेडी है, प्लीज उनको जरूर गर्भ संस्कार के बारे में बताएं, डॉक्टर रश्मि से उनको कनेक्ट करें। बिकॉज अगर आप आयुर्वेदिक गर्भ संस्कार फॉलो करते हैं ड्यूरिंग दोज 9 months, so it is very beneficial for the mother as well as the kid, the child. So वो दोनों के लिए बहुत beneficial है, उसको समझें। We will have a detailed session very soon with Dr. Rashmi again on our platform on Gav Sanskar and how people can adopt that. But she's an expert in that. Along with that, she's handling certain other issues like skin diseases, anorectal cases, and many other aspects as well. However, gynecological, I think, and infertility, by the way, is her area of expertise. So maybe you can connect with her on those domains as well. She is located in Thane, but available of her online consultation across the country and across the world as well. And she will be sharing her details also. So without wasting much time, I think all of you are eagerly waiting to listen Dr. Rashmi. And Dr. Rashmi, thank you so much. It's a pleasure to launch you on our platform. We are very much pleased and happy to have you today on this session, ma'am. Over to you, and we are looking forward to have you in many more sessions in future also on our platform. And thank you again for joining. Thanks.
Thank you so much, sir. Thank you for your lovely introduction. I would like to start my talk with taking blessing from Lord Dhanvantari, who is a Lord of Ayurveda. We have learned since uh, from all our gurus and also our Lord Dhanvantari. Ayurveda has been still been alive because of these blessings of the gods. Further, I would like to talk a little about myself and what I serve to the humanity, what I practice about Ayurveda. For the next presentation, I will also like to thank my guru, that is taking blessing from Ganesha. We have recently received a lot of blessing from him. He comes at home, gives a blessing, and then again next year he comes to give us the blessings. Taking all his blessings and taking our work upfrontly, we are here to serve to the human beings, get their problems reducing, and still keep on having their healthy life and give measures so that they can live a disease-free life, a medicine-free life. Next, I honorably thanks Dr. Piyush Juneja sir, his whole team for always being supportive for new upcoming Ayurvedic doctors to give us the confidence, to give us the practice stage, to give us a digital platform to talk about this, have a virtual launch about our practice so that the exposure becomes good. And we have also been very connected with all other doctor fraternity, our field, our family members in our Ayurvedic doctors field. Next, a small introduction about myself, what exactly I am. I am an Ayurvedic doctor. I have done my graduation, that is BAMS, and later I have done my post graduation, that is MD in Ayurvedic medicine. The next slide it is. In Kai Chikitsa medicine, I have done my post graduation, MD. So I have done my graduation, that is, I have done my graduation from Mumbai, YMT College, Maharashtra, and also I've done my post graduation also in Maharashtra, Kolhapur College, that is YMC College. After doing my graduation and post graduations, I have done after academic studies and book studies, I've gone across to the hospitals to learn my practical knowledge. That is, I've taken my practical knowledge from allopathy hospitals along with their investigation diagnostic purposes, the new upcoming going on in the medical field. To know all this, to gain the knowledge, I have done a residential medical officer duties, that is working. along with the collaborative doctors in hospitals in and around Mumbai. That is the Global Hospital, the Dhanvantri Hospital, even Jupiter Hospital, which is a very super specialty in multi-specialty hospitals, gaining all the knowledge, experience practically, and along with my Ayurvedic college work and my knowledge, it all together has blended me and given me the confidence to keep on practicing and further keep on practicing and serving to the patients, serving to the human beings. Next, I practicing initially in Kalyan, which is a suburban in Mumbai, and now I'm practicing in Thane. My address will be shortly displayed, or maybe like a website, or maybe in the link further given to us. So you can connect to me, meet me there. Next, you can also connect me online through my Facebook page. Instagram link is there, Facebook link is there, Google link will also help you to relocate to my clinic, that is Sri Mori Ayurvedic Chikitsalaya Panchakarma Kendra. You can find me, you can locate me online through for online consultations through indianvaidya.com. That is a platform for only Ayurvedic Vaidyas, and also through my website also you can gain and have benefit for online consultations. Now let me talk about exactly what Sri Muri Ayurved does. Sri Muri Ayurvedic Chikitsalaya, it's a Panchakarma center where we practice traditional old Ayurvedic medicine. Now what exactly Ayurveda means to people? What we understand is Ayurveda is some kind of medicines which is bitter to taste, which is powders, which is palatable, unpalatable, or could be like a it's an old medicine, doesn't stand long years or doesn't have a research proof. But I let me tell you, this is one particular science which has been standing firm 5,000 years back. We can't even dream of science of which is has a roots. It's an Indian original tradition medicine have so much enrooted in our country, and it's still flourishing, it giving its fruits, and I think by years and years of generation and generation it is still going to stand because it has so much potential in it. I am firm believer in Ayurveda and I have a faith of it. Hence, along with my knowledge, along with my faith, I'm able to give patients the exact the result, the treatment, the help them in the Ayurvedic ways of living. Next, Ayurveda is stating, the next slide will say exactly what Ayurveda is. Now, Ayurveda we have learned from our Rishi Munis, could be like our literatures, which was been read initially for, which was even written also in Sanskrit language, which was an ancient language, been literate at would be read, would be talked at that particular time. So we have many shlokas and many sutras which is written in Sanskrit. So Ayurveda states, according to Charak Sahita, or according to Charak, one of the literature, he states Ayurveda is hita hitam sukham dukham. हिताहितं सुखम दुखम आयुस्तस्य हिताहितं मानचतच्च यत्रोक्तम ayurveda sa uchyate. Means ayurveda doesn't only talk about the hit, which is a hit, but it also talks about the which is good, which is bad, which is happiness, which is sad, which is it also gives us a measurement to reduce our sadness, to reduce which is not good for us. This the bad habits it also enhances and give us the good part of it. How to more cultivate towards the good thing, good habits, day-to-day activities, like daily regimens. That some of the topics of Ayurveda, if you pick up the texture of Ayurveda, you pick up some literature of Ayurveda, they will exactly say you and talk you about the dincharya. They will tell you about rutucharya, things to be followed in the whole day, things to be followed even at night, things to be followed as seasonal wise, right from activities, right from food, right from panchakarma, right from sleeping habits. Everything has been discussed so minutely in Ayurveda, along with a vast disaster, vast knowledge of Ayurveda has given, stating with medicines, describing the diseases, giving the treatment, giving the panchakarma, giving the surgery also. Let me tell you, all the surgeons is also been preaching Shushrut, which is an Ayurvedic literature, who is a guru, is a rishi, who has first founder of the surgeon is Shushrut only. We have the roots of Ayurveda from him also. Next. Now let me talk specifically about my what my work is and what I am pursuing at. Now we at Rishi Moria Ayurvedic Chikitsalaya, we treating patients like osteoporosis, osteoarthritis, sciatica, lumbar pain, cervical region pain, which may land up further to spondylitis, which also lands to many other problems like spine disorders, uh, disc herniations, reducing of the space, and all these problems causes severe pain to the patients. It, some of the patients actually undergo surgery, some of the patients not able to take the bear the pain, some of the patients do land up being bedridden also. Such patients has such a excellent results in Ayurveda by doing some panchakarmas like basti treatments. So these operations or these major operations can be avoided if you take care of your spine. And we say spine is a very important part of our body. It's like a root to our body. So we have to take off the spine. The same, even though it is not an organ, but it's a very firm stand. So very importantly, taking care of all these spine disorders, Vat Vyadhis, we say specifically in Ayurveda, it helps me treat such patients at my Chikitsalaya, at my Kendra, by doing medicines and along with Panchakarma. Second, we are also able to treat medicines and we are also able to give medicines on uh, diseases which are like dermatitis, next dermatitis, like skin diseases, psoriasis, which is chronic diseases like psoriasis, eczema, and acute diseases like hormonal disturbances causing in young people, young girls, pimples, even blackish discoloration of the skin. We have a concept in Ayurveda which is describing a arm, which is describing about Viruddhana. Foods when taken in a combinations creates or makes a poison in the body. This beautiful concept has never been taught in any of the Sanskrit. It's never been taught in any of the science. This is the only science in Ayurveda which is talking about this concept. When two opposite varieties of the food or with two opposite having the qualities of the food is getting taken together as a mixture, it causes and creates poison in the body, which has a bad effect. Ayurveda also talks about when it talks about skin diseases, it also has correlation with Ayurveda is saying that skin disease is not only related to the skin, it has its roots from a digestion. It has a roots, it has a connection also with a assimilations, that is the motions are not getting passed smoothly, digestion is not happening smoothly, or even it is causing further purity or impurity of the blood, and all this impurity of the blood is then going to erupt on this skin. This is what it is saying. So when we treat skin diseases in Ayurveda, we come to the root causes making the digestion problem. Then we try to give some medicine which is also going to cure the blood, and ultimately we try to cure the skin problems. So now what exactly is Ayurveda treatment is treating the root cause of the disease. And this has been very well followed in Ayurveda by Ayurvedic medicine, by Ayurvedic Panchakarma. We at Sri Moria Ayurvedic Chikitsalaya also regularly see patients and treat in specialties like gastritis. Next slide it is estimating gastritis, even like loose motions, constipations, patients suffering from hunger issues, anxiety issues, chest burning, like burps, and all these um, problems has been easily been treated by Ayurvedic medicine. I've seen some of the patients, I've seen some of the people also. They are very comfortable taking an allopathy medicine every alternative day, every daily basis, with eating all of the junk food, specifically in Bombay. So these no any medicine apart of every medicine has an effect on the body, so every medicine has a side effect also. So anything medicine has been only to be measured and also to be taken specifically to that particular time period only. None of the medicine has to be taken for a longer period, specifically when the diseases is like acidities or indigestion problems, so which can be cured with its roots by Ayurvedic medicines. Then why take this such medicines or antacids or any of the other medicines on a regular basis. Instead, make a dietary regimen, improve your lifestyle, take your Ayurvedic medicines, get rid of the root cause, and you can live a healthy life forever ahead. And this is how we are helping by giving our support to them. Along with this, Sri Muri Ayurvedic Chikitsalayah, we also treat gynecological problems. Nowadays, women are facing lot of troubles related to menorrhagia, menstrual cycles, pregnancy related. The next slide it includes all this pregnancy related problems. Infertility is a bigger issue, specifically in cosmopolitical working women's having a sedentary life. All these things accumulates to have a bigger problem, and many of times it has been labeled as a female problems as a female origin, and these this some taboos or some tags needs to be removed by counseling, by giving proper medicines, taking care of their mental health along with the female reproductive organs. Both these systems has to be working together, and medicine will definitely help. Some of the panchakarmas like Uttar Basti will really gives very good results in this. Specifically in Garva Sanskar, we take care of the child and also the mother so that she undergoes a ease free or like pain free, a smooth and help also in normal delivery. This is how we are trying to bring the upcoming generation, upcoming child to be a healthy, wise, and immunized. This, and further also, we are taking care of the Sri Muri Ayurvedic Chikitsalaya. We definitely see patients like anorectal diseases. This is a faculty I could say is people just a small cause like wrong eating habits, a small cause like constipations, and then they'll end up doing surgeries once, twice. I've seen some of the individuals has done thrice and four times of the surgery of the same disease, which can be avoided very easily by the Ayurvedic medicines. So this diseases like piles could be bleeding piles also can be treated very well by Ayurvedic medicines. Fissure and fistula, sometimes anal abscess also. Not necessarily always antibiotics and incision and drainage has to be done. Not necessarily every time like operation has to be done, which can be avoided. Every disease doesn't need a knife to be done. Some disease can be done by giving local applications, some internal medications, some panchakarma treatment. This way we try to treat in this particular diseases. Later, we also provide some of the panchakarma specifically regular basis where I deal specifically with the five panchakarmas. These are like OPD basis and then go to the panchakarma room pay. Panchakarma in the room we do it. On OPD basis, we try to do Panchakarma simple, like in the next slide, it is already said. It is Agni Karma. Yes, it is an old technique. Then we also go for Viddha Karma, that is pain relief treatment. We go for Jaloka Vacharan, that is a Jaloka, it's a try to suck the impure blood. It really helps a lot in skin diseases problems. Even for the pain, it can helps also a lot. And we try to do Jalodhara and this Jalokavacharan, that is, even we do at the same times we also do Shirodhara. The Shirodhara has a very good result in terms of the mental. What we exactly see, many of the diseases has a mental origin. So that once your mind is free, your body will definitely be free. The body has been get free by medicines, but the mind has to be get free by good thoughts, good habits, or good like good reading patterns, or could be like good counseling sessions. All this helps boost your mental energy. So these kind of care, this kind of counseling we are doing at Sri Muri Ayurvedic Chikitsalaya. Panchakarma including like Vaman, Viration, which is gives excellent results like in diseases like indigestions, which is like disorders. Viration treatment is, I think I've seen so many patients have been getting rid of the medicines very easily within having a result also in a shorter durations. It is a very nice panchakarma treatment being done. It's a shuddhi kriya we say. Basti is ultimately the half chikitsa we say. None of the vatvedis is there which cannot be cured actually by basti. We by Basti we try to cure and reduce their symptoms, reduce their pain, reduce their etiology by giving Basti. There are two types of Basti, like we go detail about it. There are two types, or there are many types of Basti also been explained in Ayurveda. As per the disease, we try to give that Basti, and along with that medicines, we try to help the patients get rid of the mess of their disease. There are some panchakarmas like Nasya also. Some drops are given through Nasya. That is some that helps to cure the ENT diseases. It is also very important so that the person actually suffering from sinusitis, rhinitis, seasonal changes, again and again recurrent cough, cold, fever, the patients face, even the disease like COVID, which has an origin of nasal and the mouth. So it's these kind of diseases really Nasya treatment helps in increasing the immunity and getting the path also clear. The mesotract path also gets clear by it. We after all this panchakarmas and the therapy sessions, we we try to take on monthly basis some Suvarna Prashan session. There is a next slide which actually talks about Suvarna Prashan sessions, where a kid from a child that is day 1 to day 16, we try to give immunization drops, that is Ayurvedic immunization drops. This is called as Suvarna Prashan Sanskar. Out of 16 16 Sanskar which Ayurveda has said for a child to give since from birth till he gets at the age of 21, 22. So out of all this long duration, 20, 21 years, one of the sanskar is Swarnaprashan. In there, we give drops of Ayurveda medicines, which includes Swarna metal nanoparticles, which includes honey, which includes ghee, it also includes 4 Medhya Rasan, which is made together like the Medhya Rasan, which helps in improving the brain. It's like a brain tonic, increases the memory also, it gives many benefits of it. As we say, the next slide is also saying details about it. It is specifically given on nakshatra, Pushya nakshatra. The reason being Pushya nakshatra is we have some graha. Graha is also one kind of practice. Graha is one just the way we say Ratna Chikitsa, the way we say Ayurvedic Chikitsa, the way we say Graha, uh, it is astrological science. All these things somehow will make an impact on the body also. And that's the reason this is the best fruitful day to be given Swarnaprashan. It helps in digestion of the child, it helps in getting rid of the allergies, it gets also get rid of the mental and physical power, which is very important in this competitive world for a child to be mentally and physically able to compete this world. So this kind of upbringing with uh, allopathy, other than allopathy, just vitamins has been given, multivitamins is given, but in Ayurveda we have this Swarna Prashan. It's like a booster dose to us for the children. We can see all this regarding. I have talked about this Ayurvedic medicines. I've talked about the Swarna Prashan. I've talked about Panchakarma, but now but along with I'm an Ayurvedic practitioner, Panchakarma specialist. I also have passionate about my yogic practices. I've learned yoga through some organizations also, and I'm practicing yoga also. I've done my yogic education, that is diploma from Yoga Vidya Niketan. The other itself from Ministry of Ayush. This certificate schools internationally also. Initially, I did level 1 yoga instructor, and then I did level 3 as a yoga teacher. I'm recognized in all over India and evaluator also. Further putting my more efforts in yoga and my passion towards it, I have gained knowledge regarding and making an expert in pregnancy yoga. That means all 9 months, a pregnant lady, what yogic practices she should be doing, what asana should be doing, how Garbha Sanskar is for her helpful and for her child also. All this expertise I have learned and I'm trying to give it to the pregnant lady. This I do along with my team, which is the Splendora Yoga Center, a health and wellness center, where we are medical and non-medical. There are yoga teachers. We together, along with me, my Chikitsalaya center, we try to together give to the society, so that we create good human beings, we create healthy babies, we let pregnancy go by ease, and help the human beings, helps even the other than the disease also, other healthy individuals also, we try to give them all our benefits through our yoga practices, through our yoga sessions. We take workshops regarding that. Could be workshops like kids yoga, could be like workshops like pranayam, asanas, could be workshops like even we take Surya Namaskar and Chandra Namaskar, which is a very basic thing, but still many of the, even in India, people don't know how to do it. I'm really very thankful to Sri Narendra Modi ji. So his keen interest and his efforts been continuously been appreciated, that he's putting India forward internationally, globally, and taking Ayurveda, taking yoga also towards the upfrontly, so that we are being recognized as the Indian citizens. We have been recognized by an Indian traditional old medicine, which is Ayurveda, which also we recognize from our yogic background, and we could be able to make a firm to stand in front of the world and give us something which we are rich enriched in. And this kind of 5,000 years of knowledge, which we are being following it, we are trying to give it for the generations and generations, and me being one of the part to that journey, and I'm happy that I am giving this on my path and trying to help others also walk the path of this. We regularly take this workshops like pregnancy yoga, kids yoga. These kinds of workshop has been taken collaborative towards us. So once again, I would like to thank Dr. Piyush Juneja, sir, the whole Indian Vaidya team for all my support, for all their continuously good support, for continuously helping me to, and all the Ayurvedic doctors also, like young doctors like me, so that they can practice with his support, with they can practice Ayurveda, so that Ayurveda stays long years. Even
Thank you, ma'am.